Hello, my name is Jim Coy. I'm the Secretary of the Association, or the American Academy of Environmental Medicine, and I was asked to say something about the effect and treatment of heavy metals in our practice. When a patient comes to us with symptoms of fatigue or headaches or decreased neurological function or almost anything, shortness of breath, this myriad of symptoms that we start the process of excluding diseases that are pretty commonly known and well researched. In the back of our minds always is the idea of the exposure to environmental toxins, and probably the most ubiquitous toxin and group of toxins in our culture today is the heavy metals. And heavy metals are very limited, if any, in function in the human body, and therefore they are stored and distributed supposedly safely so that they will not cause illness or decreased function. However, when they accumulate enough, they do. So our approach to this very commonly is to have the level of suspicion. Our training in regular medical school was not very clear on this. So it is a higher level of index suspicion that we have. One of the first places we look, of course, is in the mouth, and not only do we look at the throat and the tonsils and the palate and these things, we look at the teeth, and then we look at what has been done to the teeth. We are not in the dentistry field, and things like infection we may refer or we may treat, but we see the heavy metals and we can get a good idea of what we're up against. One of the things that we do for screening for heavy metals has been a tried and tested test of tissue analysis for heavy metals, and we use the hair analysis because we can test for skin or bone or muscle, but the hair is readily available, and it has been used as a test for at least 30 years clinically in our experience. So we'll get a screen with a hair sample from various laboratories that specialize in this, and we can learn of heavy metal accumulation. And if we get a little bit more suspicion, then there are agents that will bind with metals. We call this a chelation process, and we can do what we call challenge tests, in which we will put a chelating agent in the body and measure the resultant heavy metals that are that come out through the urine or the fecal material. And so we start to build a body of evidence as to how much heavy metal toxicity or accumulation has taken place. Various methods of removing the heavy metals have been used for years, for centuries. There are herbal elements that can be used, and they've been studied a great deal. Unfortunately, in environmental medicine, from the allopathic side, we have to find out on our own many times, something that naturopaths and homeopaths have been looking for years, and there are homeopathic and naturopathic remedies. We usually subscribe a lot more to the chemical industry and its chelation chemistry, and there are different chelators for different metals, and they must be very carefully applied, carefully administered, and the more we are learning about it, the more complicated the system gets, because the amount of heavy metals in our environment that we are exposed to is extremely high, and therefore the problem never seems to go away. So if we do not take care of heavy metal toxicity, we are not going to be able to take care of environmental illness. Thank you.